871 in Medic 6. You're seeing a 74-year-old male, shortness of breath.
Every day, you are faced with hundreds of decisions. Some are so routine, you may not even consider them as a conscious act. Other decisions can be a matter of life or death. When you are faced with one of these, how do you know what to do? When you first arrive on scene, you begin with observations and then let protocols, standing orders, and treatment algorithms guide your actions. These are valuable tools that provide a standardized approach to patients with common medical or trauma-related emergencies. But what happens if your patient doesn't fall into one of these common emergencies? What if their presentation is not so classic? This is when critical thinking skills or clinical decision-making is so important.
What is critical decision-making? Critical decision-making is the taking all of your knowledge, taking all of your book smarts, taking your historical experience with managing patients like a patient that you have, all the variables, putting them into some kind of an organized format, and then acting based on the picture that you paint. It's the ability to use your tools appropriately. It's very hard to define, but it's probably one of the most important parts of any healthcare provider's professional approach to patients. It's the ability to take multiple variables, add your knowledge, add your experience, and do the right thing for patients.
Critical decision-making is an analytical process that can help you think through a problem in an organized and systematic manner. It can be learned through studying and practicing concepts, from hands-on training, and from experience in the field. You also have to learn how to go beyond the cookbook approach to scene management or patient care, especially when you are faced with a challenging situation. Each time you deliver care, you are gathering, evaluating, and synthesizing information. You are developing and implementing a plan and making independent decisions based on your best judgment. And, as if this wasn't enough, you're thinking and acting under intense pressure. Critical decision-making utilizes not just protocols, but all of your experience and puts it to the test.
Nobody ever gets to a point where their clinical decision-making is perfect. It's a journey. It's not a destination, it's a journey. We're constantly refining our abilities to be good decision-makers. I think there are two things that are critically important in any kind of decision-making in the healthcare environment. One is that we continue to learn over and over from every single patient encounter that we have, good and bad, which is why looking at your mistakes, looking at the mistakes of others, the infamous EMS wrong turns, are very important for professional development, because it allows us to look at how we assessed or managed someone. We look at the outcome and then we go, gosh, you know what, next time I would do X, Y, or Z. So experience and learning from experiences, good or bad, very, very important. Two is watching someone who's a superstar. Everybody has their hero in EMS. Everybody has someone that they go, man, I'd really like to be like them. Look, every time they get on a scene, they know exactly what's going on. They look great, they choreograph, they pick up on things, they make the right decisions. And in any field of medicine, when one provider watches another do it exceptionally well and watches what the outcomes are, we tend to want to be like that. And critical decision making can be learned in that fashion. So the two together, I think, are a real value in developing critical decision making. Repeatedly doing it over and over again and learning from it, that's a key point, and watching those that do it beautifully and trying to approach patients the way they do.
Algorithms and treatment protocols provide a clear direction for classic patient presentations or situations, but they are difficult to follow with non-classic presentations or for a patient presenting with varied symptoms and signs.
there are pros and cons to protocol, standing orders, guidelines in the field setting. Every EMS system has some form of protocol or standing orders. That's the way we do that business in the EMS environment. The downside of very detailed protocols is over time, I think it really doesn't push the individual practitioner to use his or her head, to think through things, to say, gosh, I've got to figure out what to do with this patient. I think there's a value in that. We want folks in the field to be thinkers. I think EMS is as successful as it is because we can take a scenario we've never ever learned about, we've never seen before in our lives, and we can figure out what to do with it, because you can't possibly have a textbook that has every single potential illness or injury in it. So the pros and cons of the very detailed protocol, I think, are the pros are that you can put a lot of information in there. The cons are that it doesn't stimulate independent thinking.
It is important to gain a broader understanding of signs, symptoms, and causes of patient presentations so that you are not limited in your approach or in your thinking. Increasing your knowledge about trauma, specific disease pathology, anatomy, and physiology will aid in your critical thinking process and allow you to evaluate the risks and benefits of your treatment decisions. Gaining a better understanding of medications, how they work, what interactions can occur, will also enhance your patient treatment decisions. Putting all this information to the test is hard, especially when you are under pressure. So, what can you do?
One of the strategies for developing critical decision-making skills under pressure is to create an environment that is not truly under pressure, but forces you to make those decisions. What do I mean by that? Let's say I'm brand new in EMS and I'm with my mentor, my preceptor, my training officer, and we have a diabetic patient that's hypoglycemic. And I walk through and I do my assessment and I give the patient glucose, and everybody lives happily ever after, taken care of. Not an intense call, but to take that same call and say, okay, now what would you do? Hang on, what would you do if the patient seized now and the patient vomited? What would you do? To create an environment where we start thinking about what the intervention would be if things changed, even though they're not changing in that patient, has a lot of value. You have to be very careful with patients because you don't want to be creating situations where the patient's listening going, oh, I'm having a heart attack. So it's got to be done appropriately. But taking a patient care scenario and doing what ifs and thinking through those what ifs so that you're comfortable when it happens is very important.
The fundamental elements of critical decision-making rely on 7 essential criteria. This starts with an adequate foundation of knowledge. From training, education, and experience, you understand how and why injuries or medical conditions affect a patient. Next, you have to have the ability to focus on specific and multiple elements of data, and by assimilating all the different information, you can then direct your assessment and treatment. You should be able to identify, organize data, and form concepts. With an overall understanding of the situation, you are able to provide treatments based on what information you have obtained. You have the ability to identify and deal with medical ambiguity. You can take overwhelming amounts or limited amounts of information, differentiate between relevant and irrelevant data, determine what is critical, and direct your assessment and care. You have the ability to analyze and compare similar situations, even though no 2 patients are the same. You can integrate information obtained from previous experiences into your current situation. You can recall contrary situations. Learning from bad experiences enhances your ability to manage your current situation. And finally, you can articulate assessment-based decisions and construct arguments, defending your actions and justifying the decisions you made regarding treatments you delivered. The range of patient conditions, whether non-life-threatening, critical, or potentially critical, is referred to as the spectrum of acuity. Your challenge will be treating patients whose clinical presentations are vague, obscure, or changing. You will have to carefully synthesize information and systematically assess and maintain a high index of suspicion with these types of patients.
One thing that's not totally unique, but a little more unique in the out-of-hospital emergency medicine environment, or EMS, is that decision making is constantly changing. Just when you think everything's fine, something changes, and you redirect your plan, you reassess the patient, you reassess the scene, you reassess your resources, and you come up with plan B, and then plan C, and then plan D. So simply resting on our laurels saying, whew, taking care of that patient, now all we have to do is take them to the hospital, is not part of this practice. It's constantly changing, and it's constantly in evolution, and we have to be able to adapt to that.
Large, complex scenes will also test your skills.
Some of the hard, critical decisions are multiple patients in chaotic scenes. Scene assessment and triage. How do you appropriately size up a big chunk of mess to get it into something that's relatively organized? How do you, as a healthcare provider, keep yourself from going over to the patient that looks like they need you the most when you've got so many patients? So being able to think through how to do the most for a large number of patients is a tough decision, and one that's learned and practiced over time.
Practicing, participating in drills, and following the same action plan on every call, no matter how large or small, will help create a standardized approach that eventually becomes habit. Repetition and routine improves your clinical decision-making. One way to help you with critical decision-making is by using a system to help you remember the steps and guide your thinking. There are many models, but one is the 6 R's of clinical decision-making. These steps will help remind you of how you need to proceed when you're on scene and need to put all of your training, knowledge, and experience together. Read the scene. Your scene size-up begins when you first arrive and you assess for hazards. Read the patient. This is done as you are forming a general impression of the patient's condition. React. Rapidly identify life-threatening conditions and react immediately. Reevaluate. After starting treatments, reassess the effectiveness of your care decisions. Revise. Modify treatment plan as needed based on the patient's response to your care. Review. By evaluating performance, personally or by others, you will continually improve the quality of the care you provide. The pre-hospital environment is unpredictable and stressful. It is important that you be able to think and work under pressure. Mental conditioning is the key to good performance in a situation of controlled chaos. Developing habits and applying them to every call leads to an approach that will be second nature during challenging times. Information can be overwhelming and emotionally taxing, but you must be able to make good decisions rapidly.
Critical decision making about when to intervene with an invasive procedure, and probably the best today is endotracheal intubation, with a lot of the discussion and controversy surrounding whether it hurts or helps. I think one thing that everyone would agree on is the decision-making process that gets you to a point that says you need to have a tube in your lungs ought to be very, very carefully and very critically evaluated as we go through getting to the point that says, hey, you need an endotracheal tube. Because we can harm. We have to remember, we never intend to, but we can harm with procedures, and whether that's endotracheal intubation, whether that's putting someone on a backboard, every procedure has both the good, which is what we're striving for, and the potential bad sides, and it's our responsibility to weigh the pros and cons as we deliver those procedures in the field.
Many factors will hamper your ability to function effectively. Crowds, volatile scenes, poor lighting, extreme weather, rough ambulance rides. Being able to improvise, adapt, and overcome these always challenging obstacles of the pre-hospital environment while still providing excellent patient care are hallmarks of success.
One of the toughest, historically, that EMS providers have struggled with is the determination of death. Because once you make that decision, once you decide that someone is dead, the outcome is usually pretty done. The patient is not going to survive the event if you've made the decision appropriately. But without any intervention, the patient has no chance. for potential survival. So the thought process leading up to the decision to start or not start resuscitative efforts, or to cease resuscitative efforts, is a significant analysis of multiple variables, a lot of input, and having to take all that stuff and say, I'm going to make the right decision. And by the way, the tough part of a lot of critical decision making in emergency medicine and EMS is that there is a time dependency to it. So we're expected to make some pretty significant decisions with a limited amount of data in a relatively short period of time. So compacting all that into a package it really illustrates why it's so important to be good at critical decision making.
With all of the challenges of delivering treatment in the pre-hospital environment, errors do happen. If you realize you've made a mistake, what should you do?
We're in a human being business. We have to make decisions, and we do the best job we can with the tools that we have. We will not always make the exact right decision, and we'll make errors. The important part of those errors is that we deal with them effectively and appropriately. As soon as the error is made, it is our absolute 100% responsibility to focus on what the implications of that error were on our patient, and to do everything we can at that point in time to fix the results of that error.
Lessons learned, successes, mistakes, areas to improve. Run reviews are an excellent way to improve critical decision-making skills.
We've learned a lot about how we deliver medicine by some of the errors in delivering it in the field. What do I mean by that? I mean that we often see where, for whatever reason, the right approach, the right drug, the right technique, the right decision wasn't applied to a patient. And as we go back and we look at why, you realize, gosh, of course this would happen. There wasn't an opportunity for the right thing to happen because, gosh, maybe we don't have that piece of equipment, or maybe we've never done this particular educational component. Unfortunately, many EMS systems, medicine, deals with errors in a punitive way, a disciplinary way, as opposed to a performance way. If I make a mistake, I don't want you to punish me. I want you to fix me. I want you to get in there and say, hey, Rocked, you did this, this, and that. You should have done this and this, and here's why. Now, if I continue to make that same error, that's a different story, because I might not be capable of learning or fixing myself. But as we embrace errors, as odd as it sounds, as we embrace them and say, you know what, that happened, we have to figure out why it happened. Let's walk through every little piece of it, and let's figure out how we're going to keep it from happening in the future. It becomes a valuable tool, not only for the individual, but for the rest of the organization that works in that same environment.
Your goal should be constantly striving to improve your skills in the care you deliver. Understanding your own personal learning style and seeking out opportunities to practice your skills will be critical to your growth and success as a healthcare provider.
One of the biggest challenges of teaching critical thinking skills or critical decision making is that it's hard to teach. We all learn differently. Some people are visual learners. Some people learn by repetition. Some people love to just study the written word. Some people watch DVDs for education. It's just amazing. But people learn in different ways. Trying to take what I think you need for your critical decision-making skills and impart it on you isn't necessarily going to do the trick. You've got to start figuring out how you make decisions, what resources you need to make the right decisions, and start developing that. That's why repeating it over and over again and learning from mistakes is so important, and why hooking up with someone who you think does it very, very well, watching them, imitating how they make those decisions, has a huge impact on individual decision-making skills. Remember, it's a journey, and we'll never be there. We'll never be at a point, good healthcare practitioners will never be at a point where their critical decision-making is perfect. If they are, they're not looking hard enough. So continually refining it and making it better is an important part of every healthcare practitioner's professional development.
Remember, We need to embrace lifelong learning to improve our critical decision making and therefore our care delivery to our patients. Be open to new learning styles, new techniques, and ways of doing things, and continue to improve yourself with continuing education, continuous quality improvement activities, and reading journals. Your patient's life depends on it.